Hello, and welcome back to my education series in reducing avoidable hospitalizations in long-term care settings. My name is Sarah Becker, and I am a family nurse practitioner currently working on my doctoral project. So this week we're going to focus on those top 5 conditions that we've discussed about before, and really, why do these conditions matter? In long-term care settings, there are these 5 clinical conditions: urinary tract infections, pneumonia, congestive heart failure, dehydration, and COPD that are responsible for nearly 78% of potentially avoidable hospitalizations. Let's pause and consider the significance of this figure. Almost 80% of hospitalizations among long-term care residents are related to these 5 clinical conditions. This concentration of hospital transfers around such a small set of conditions highlights a critical opportunity for targeted clinical vigilance and proactive management within the long-term care setting. Additionally, these conditions are particularly dangerous for frail and elderly residents due to their vulnerability to rapidly decline and these complications. Early recognition and timely treatment can significantly reduce the need for hospital transfers. According to Walsh et al., targeting these 5 conditions directly enables long-term care teams to intervene earlier, stabilize residents on site, and ultimately improve clinical outcomes through a more consistent and patient-centered management. Hospital transfers for these conditions are associated with increased risks of delirium, functional decline, and emotional distress, particularly for frail older adults who may not return to their baseline level of functioning post-discharge. By prioritizing early detection, individualized care planning, and in-house management, long-term care teams can ensure that treatment decisions reflect the resident's goals and preferences, thereby enhancing quality of life and preserving dignity. This approach aligns with the principles of person-centered care and supports continuity in familiar environments, which is especially critical for residents with cognitive impairments. So let's talk about the risks of these hospital transfers in the frail elderly. Hospital transfers can be traumatic for long-term care residents, particularly those with cognitive impairments. The unfamiliar hospital environment, disruption of daily routines, and exposure to hospital-acquired infections contributes to emotional distress and physical deterioration. These effects are magnified in frail elderly individuals who often experience a decline in functional status and quality of life following hospitalization. RTI International highlights that avoiding hospitalization when safe and appropriate is essential to preserving resident well-being and reducing healthcare costs. Facilities must recognize the clinical and emotional toll of hospital transfers and implement strategies to manage conditions in-house whenever possible. Structured interdisciplinary interventions, such as outlined in the INTERACT program, have demonstrated measurable reductions in hospitalizations by equipping staff with tools for early detection and on-site management of acute conditions. Moreover, when advanced care planning is integrated into routine practice, residents are more likely to receive care that is aligned with their preferences, thus reducing transfers that may be medically unnecessary or, even worse, emotionally harmful. How can we empower our long-term care teams? Interdisciplinary collaboration is a foundational strategy in reducing avoidable hospitalizations. This strategy involves everyone that comes in contact with these residents. Evidence demonstrates that social workers and case managers are instrumental in addressing health-related social needs, which, if left unaddressed, contribute to increased hospital utilization and ultimately poor health outcomes. These professionals serve as system navigators and psychosocial support providers, facilitating facilitating continuity of care and reducing fragmented care during these transitions between long-term care and hospital settings. Pharmacists also play a critical role in interdisciplinary teams by conducting medication reviews that identify and resolve drug-related problems, which are prevalent in up to 75% of long-term care residents and are a major contributor to hospital admissions. Structured pharmacist-led interventions have been shown to significantly increase medication appropriateness and reduce unnecessary prescriptions, although sustained efforts are needed to impact hospitalization rates meaningfully. Effective communication between long-term care staff and emergency department personnel is equally vital. Programs such as Interact have demonstrated that standardized communication protocols like SBAR and Stop and Watch can reduce hospital admissions by up to 17% by enabling timely recognition and management of acute changes in condition within the facility. Moreover, fostering proactive relationships between long-term care and hospital teams supports shared decision-making and ensures that care aligns with the residents' goals and advanced directives. This is especially important in managing conditions such as UTIs, pneumonia, CHF, dehydration, and COPD. Those sound familiar? This is where early detection and in-house treatment can prevent escalation and transfer. A synthesis of interprofessional collaboration in older adult care highlights that successful interdisciplinary teamwork depends on shared professional identity, effective governance, and culture of continuous learning. When long-term care facilities invest in team-based education and empower staff with evidence-based tools, they cultivate a vigilant care environment that prioritizes resident safety, reduces unnecessary hospitalizations, and enhances quality of life. Here are my references. I hope you enjoyed this week's quick little tutorial, and I look forward to hearing from you, and I hope you have a wonderful week.